Meet Jessica, a dedicated call center manager whose life has been shadowed by persistent pain and disruptive periods. Little did she know that a hidden adversary, endometriosis, was silently affecting her well-being. What exactly is endometriosis, and how can its far-reaching impacts be managed? Join us on this enlightening journey as we delve into the intricacies of this condition, unravel its mysteries, and unveil the strategies that can lead to relief and empowerment. Stay tuned to gain a comprehensive understanding of endometriosis and discover the insights you've been searching for. Your path to a better quality of life begins here. In the bustling world of call center management, Jessica's unwavering dedication was commendable. However, there was an unseen adversary that recurrently disrupted her life, excruciating periods accompanied by excessive bleeding. This unrelenting issue had gradually transformed into a hurdle, demanding a week of respite every month, putting her job and daily routines in jeopardy. As a seasoned gynecologist with over 2 decades of experience, I embarked on a journey to unearth the underlying cause of Jessica's distress. Her commitment to her career was undeniable, and it was my mission to provide her with the relief she so desperately needed. Our initial round of tests, including ultrasounds, painted a perplexing picture. Everything appeared within the realms of normalcy. Yet, Jessica's persistent pain and disruptive periods told a different story, one that was veiled in mystery. To gain a clearer understanding, I proposed a laparoscopic procedure, a minimally invasive technique that often serves as a window into the hidden truths of gynecological health. The day of the procedure arrived, and as Jessica underwent the laparoscopic exploration, my suspicions began to crystallize. The findings were telling: endometriosis, a complex and often enigmatic disorder that occurs when tissue similar to the uterine lining grows outside the uterus. This mischievous tissue responds to the menstrual cycle, shedding and bleeding just like the uterine lining, but with no escape route. The result? Pain, inflammation, and the potential for scarring that can wreak havoc on a woman's life. As I stood by Jessica's side, armed with both experience and compassion, I explained the nature of her condition. Endometriosis had woven its intricate web within her body, causing the distressing symptoms she had endured for far too long. But there was a silver lining. A better understanding of the enemy at hand meant that we could chart a course toward relief and restoration. Jessica curiously asked, what causes endometriosis? The cause of endometriosis is unknown. When you have endometriosis, tissue similar to the lining of your uterus grows in the wrong places. When it develops in places like the outside of your uterus, fallopian tubes, ovaries, intestine, and within your pelvic cavity, it can cause painful symptoms. This pain is related to increased inflammation and often fibrosis and adhesions. When endometrial-like tissue grows outside of your uterus, it can cause scar tissue, adhesions. These sections of scar tissue can fuse your organs, creating connections between them that normally wouldn't be there. This can lead to discomfort and pain. She asked, what are the symptoms of endometriosis? There are many symptoms connected with endometriosis. The main symptom is pain. This pain can be intense or mild. It can typically be felt in your abdomen, pelvic region, and lower back. Although endometriosis is a common condition, not all females will experience symptoms. Sometimes, you can have endometriosis and not know until it's found during another procedure or investigation of infertility. People who do experience symptoms of endometriosis may have very painful menstrual cramps, abdominal pain or back pain during your period or in between periods, pain during sex, heavy bleeding during periods or spotting, light bleeding between periods, infertility. There's no connection between the symptoms of endometriosis and the severity of the condition. Some people may have very few patches of endometriosis and still experience severe pain. Other people might have severe endometriosis, but not experience a great deal of pain. What are the first symptoms of endometriosis? Many people experience pain during periods from endometriosis. This pain is often felt in your abdomen, lower back, and pelvic area. Periods can also be heavier than typical, and there can be spotting or light bleeding between cycles. How is endometriosis diagnosed? In many cases, an endometriosis diagnosis will start with your symptoms. Painful and heavy periods might cause you to reach out to your healthcare provider. Once at an appointment, your provider may start by asking you for your personal medical history, about any previous pregnancies and if any other people in your family have endometriosis. Your doctor may do a pelvic exam. If your healthcare provider needs more information, they'll likely perform pelvic imaging starting with an ultrasound. Depending on your symptoms, physical exam, and ultrasound results, an MRI may also be ordered for further endometriosis mapping. A laparoscopy may be offered for both definitive diagnosis and treatment. It can be a useful way to confirm endometriosis because surgeon doing the procedure can use a small camera or laparoscope to look inside your body. Sometimes, you find endometriosis by accident. Not all people who have endometriosis will experience symptoms. In these cases, your provider might discover the condition during a different procedure. Jessica asked, what is the treatment for endometriosis? I will help create your treatment plan for endometriosis based on a few factors, including the severity of your endometriosis, your plans for future pregnancies, your age, the severity of your symptoms. In many cases, your treatment plan will focus primarily on managing your pain and improving fertility issues, if you are planning on a future pregnancy. This can be done through medications and surgery. Medications are often used to help control the symptoms of endometriosis. These can include pain medications and hormone therapies. Hormonal options for suppressing endometriosis can include birth control. There are multiple forms of hormonal suppression options, including combination options using estrogen and progesterone or progesterone-only options. With all of these medications, it's important to note that your symptoms can come back if you stop taking the medication. These medications aren't recommended during pregnancy or if you are actively attempting to achieve pregnancy. Medications for endometriosis pain relief can include over-the-counter pain relief, non-steroidal anti-inflammatory drugs, NSAIDs. In some cases, your provider might recommend surgery as a way to confirm and treat endometriosis. There are always risks to a surgical procedure. However, surgery for endometriosis can be an effective way to relieve pain and, in some cases, improve your fertility. Endometriosis is considered a chronic disease. Many people experience relief from endometriosis pain after surgery, but the symptoms may return within a few years. The severity of your endometriosis could play a part in how quickly, if at all, it comes back after surgery. Surgical options to treat endometriosis include laparoscopy. In this procedure, your surgeon will make a very small cut in your abdomen and insert a thin tube-like tool called a laparoscope into your body. Hysterectomy. In severe cases, your doctor may suggest removing your uterus based on the amount of endometriosis and scar tissue present, if you have other uterine conditions like adenomyosis and your desire for future fertility. Jessie became anxious to hear about surgery. She asked, can endometriosis go away on its own? In some cases, endometriosis can go away on its own. Over time, endometriosis lesions can occasionally get smaller, and you may have fewer of them. This can also happen after menopause, which is often related to a drop in the amount of estrogen in your body. What happens if endometriosis is left untreated? Over time, the endometrial-like tissue that grows outside of your uterus can cause cysts, adhesions, and scar tissue. This can cause you to experience long-term, chronic pain, especially during menstrual periods. Many people with endometriosis may also have difficulties getting pregnant. Treatment can sometimes help with this issue. As you age and go through menopause, the symptoms of endometriosis may improve. This is related to the hormonal changes your body goes through during menopause. A few factors that can reduce your risk of endometriosis include pregnancy and breastfeeding, maintaining a weight that's healthy for you, starting your menstrual period at a later age. Jessica inquired, what are the complications of endometriosis? There are several medical complications that can happen if you have endometriosis. People with endometriosis may experience infertility issues. This can sometimes be helped with treatment options like medications, surgery for endometriosis, or fertility treatments like IVF. People with endometriosis can also experience bowel or bladder issues. These may include pain with voiding or with bowel movements, or seeing blood in your urine, pee, or stool, poop. With severe endometriosis of your ureter, the tube that carries urine from your kidney to your bladder, you can occasionally get swelling of your kidney. Can you get pregnant if you have endometriosis? You can get pregnant if you have endometriosis. However, people with endometriosis can have a difficult time getting pregnant. This condition can be a common cause of infertility. If you have endometriosis and want to get pregnant, talk to your doctor about the best treatment option for you. You might need to change your medication or, in some cases, pursue a surgical option to treat your endometriosis. Your provider will work with you to find the best treatment plan to help support a pregnancy. Can you still have endometriosis after menopause? Menopause is a time of major change in your body. One thing that happens during this transition is a change in the levels of hormones in your body, specifically estrogen. There's a link between your reproductive hormones and endometriosis. After menopause, with decreased estrogen levels, endometriosis lesions often decrease. This can also mean that you no longer experience symptoms of the condition or that they're less intense than before menopause. However, if you take hormones as a treatment for any symptoms you experience during menopause, your endometriosis may still cause symptoms. Veil of uncertainty lifted, Jessica and I embarked on a meticulously crafted treatment strategy to combat the formidable foe of endometriosis that had disrupted her life for far too long. Holistic pain management. Understanding that pain relief was a top priority, we initiated a comprehensive approach. Jessica was prescribed pain medications tailored to her specific needs, ensuring that her discomfort was alleviated while minimizing potential side effects. Hormonal therapy. To counter the cyclical nature of endometriosis and mitigate its impact, we explored hormonal therapy options. By regulating Jessica's hormonal fluctuations, we aim to reduce the growth and shedding of the problematic endometrial tissue. Jessica's progress was not a solitary endeavor. Regular follow-up appointments allowed us to assess the effectiveness of the treatment plan, make any necessary adjustments, and provide the emotional support she needed on her path to recovery. Over the course of months, Jessica's determination coupled with our collaborative efforts began to yield promising results. The debilitating pain she once battled with began to recede, and her periods gradually became less disruptive. The excessive bleeding that had been a constant challenge started to subside, allowing her to regain a sense of normalcy. As Jessica's call center responsibilities resumed without the looming shadow of incapacitating pain, her quality of life improved. The one-week hiatus that had become an unwelcome norm gradually faded into a distant memory. With each step forward, her resilience was a testament to the remarkable capacity of the human spirit to triumph over adversity. While the journey was not without its challenges, Jessica's story is one of inspiration. Through perseverance, personalized care, and a comprehensive treatment strategy, we were able to not only manage her endometriosis but also restore her sense of agency and vitality. As her gynecologist, witnessing Jessica's transformation was a humbling reminder of the profound impact that medical expertise and compassionate care can have on the lives of individuals. While the battle against endometriosis was undoubtedly arduous, Jessica's unwavering spirit, coupled with our collaborative efforts, brought forth a newfound chapter of hope, resilience, and restored well-being. As we reach the conclusion of this video, I want to extend my heartfelt gratitude for joining us on this journey. Your time and attention are truly appreciated. Remember, knowledge is a powerful tool, and by staying engaged till the end, you've equipped yourself with valuable insights. If you found this video helpful, don't forget to hit the like button and share it with those who might benefit from the information shared here. And of course, if you haven't already, make sure to subscribe and click the notification bell so you never miss out on our upcoming content. Thank you once again for being a part of our community. Let's continue to learn, grow, and support each other on this incredible journey of knowledge and understanding.